Next month, thousands of Idahoans could be left without mental health care as the state plans to pull funding for programs that stabilize and uplift people in crisis. I'm neighborhood reporter Allie Tripke, and when providers heard about the cuts, they reached out to Idaho News 6 to express concerns about the change that will impact all Idahoans.
I remember the cold air and the stillness and the thought that maybe this was it. Maybe there was no way forward. But then something inside me whispered, call. Just one call, one person.
Peer support supervisor Alton Urbidva was on the other end of that call, a call for help that became a story of hope and survival.
I am proof that recovery is real. I am proof that reaching out is powerful. And there are people, peer support providers, ready to walk with you.
Urbidva says the person in crisis who called that night is alive today because of state-funded resources like the peer support program, one among several services that are set to be cut on December 1st under Idaho's Medicaid reductions.
Myself, like everybody else, was horrified when we heard the level of cuts that were happening.
Mental health providers across Idaho say eliminating funding for essential medications, resources, and professionals who serve vulnerable and high-risk people could have devastating consequences, even posing a public safety risk.
There is a higher risk of hospitalization, there is a higher risk of homelessness, there is a higher risk of incarceration. This can be truly life-changing for these individuals. And we are very worried.
Rick Boyce, who oversees behavioral health care in Idaho, says one of the most impactful programs on the chopping block is Assertive Community Treatment, or ACT, which helps stabilize nearly 500 people who may harm themselves or others, including those living with schizophrenia, PTSD, and other mental health challenges. The proactive programs not only save the state money long term, but also keep Idaho neighborhoods safe while employing hundreds of specialists like Urbidva.
Instead of cutting it, we need to increase it. We can always utilize more peer support specialists.
When people who are stable and positive within their community go off of long-term medications, unpredictable things happen. We need to make change, and we need to protect these programs.
Providers are calling on the Idaho Department of Health and Welfare, Magellan Healthcare of Idaho, and Governor Brad Little to reinstate funding. I reached out to the agencies for comment but did not hear back from the governor's office. DHW tells me they worked with Magellan to see what programs they could pull and that there are, quote, no easy options to achieve the needed budget reductions. Full statements can be found on idahonews6.com. If you or someone you know is in crisis, you can reach out to the Suicide and Crisis Lifeline by calling or texting 988. In studio, I'm neighborhood reporter Allie Tripke for Idaho News 6.